The Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate, says Nigeria's health sector is showing measurable progress as the country tracks performance and strengthening reforms under the Health Sector Renewed Investment Initiative. Speaking at a press briefing in Abuja ahead of the 2025 Joint Annual Health Sector Review, Pate revealed 5 spotlight sessions planned for the review, which includes efforts to curb maternal mortality through the MAMI initiative, improvements in sector governance and transparency, local manufacturing of medical products, and a review of national health expenditure patterns. The minister revealed that 37 out of 41 key performance indicators in the sector have been achieved, while 35 out of 36 states and the FCT have conducted their own performance review with citizens' participation.
Now, coming to service delivery, there has been overall improvement in key maternal and reproductive health indicators in 2025, including ANC1, ANC4, the first antenatal care and the fourth antenatal care, skilled birth attendance, facility deliveries, use of pathographs, and uptake of family planning services based on the data that we have collected. So despite the challenging time that we have in this country, at least from the data that we're seeing, the collective effort of states, local governments, private sector, civil society, federal government, all of us, is translating into results, increases in key maternal and reproductive health indicators in 2025. And primary healthcare utilization, the general attendance in BHCPF facilities has also increased. 37 million in the first quarter of 2025, 45 million in the second quarter of 2025, compared to only 10 million in the first quarter of 2024. That's almost a 4-fold increase in utilization. New family acceptors have increased steadily each quarter, with an overall 10% increase from first quarter of 2025 to quarter 3 of 2025. This is a very promising trend for crashing maternal mortality, for allowing women to also be able to have a handle on their reproductive rights. 50% of women of reproductive age were using modern contraceptives, and routine data show modest improvement in vaccination coverage for specific antigens. In terms of outcomes, again, more good news. I hope the media is paying close attention to this. For MAMI, the effort to crash maternal mortality, in the 172 local governments, which accounted for more than half the maternal deaths in Nigeria, we've seen 17% reduction in maternal deaths.
He explained that the 2025 review will assess sector performance on major health indicators and feature the signing of an updated health compact, now expanded to include local government areas, religious leaders, and civil society organizations.
So while we're not out of the woods, the fact that we're able to now, with 2-year data, tell a story that is showing beginnings of an improvement, if we can sustain it between the federal government and our states, local government, and every actor over time, then the health outcomes of our population will certainly improve. But there are challenges ahead, which we are determined to continue to work through them, including ensuring the financing is available, federal government's own resources, states' own resources, because the external financing that has been very helpful to us is no longer guaranteed. The 2025 Joint Annual Review will assess the health sector performance on the key indicators and feature the signing of an updated compact with an addendum to include local government areas. Because when we signed the first compact, that was before the major decision in terms of the role of local governments in our own fiscal federalism.
According to the minister, the event is expected to build on last year's baseline and serves as a key accountability tool for tracking collective progress across federal, state, state and local levels for the first time, states operational plans now aligns with the federal health priorities.